Hello everyone, myself Kajal Awate, roll number 2, studying in final year B Pharmacy from Shivajirao S. Zonde College of Pharmacy, Asangaon. Today I am here to discuss about the anti-epileptic agent under the guidance of Dr. Nitin Mohire as a professor and principal of our college. Today we discuss about the definition, types, causes, symptoms, diagnosis and anti-epileptic drug. First of all, what is epilepsy? Epilepsy is the excessive firing of a neurons. The mechanism underlying the epilepsy are imbalance between the excitatory or inhibitory neurotransmitter. Types of a seizure. Seizure classified into generalized seizure and partial seizure. Generalized seizure occur in full brain and partial seizure occur in only a part of a brain. Then generalized seizure again subtypes into tonic-clonic seizure, clonic seizure, tonic seizure, myoclonic seizure, atomic seizure and absence seizure. Then partial seizure classified into simple partial seizure, complex partial seizure, partial with the secondary generalized seizure. Generalized seizure. Generalized seizure involve the whole brain. It subtypes into a tonic seizure which causes a muscle relaxation. Clonic seizure which causes a muscle contraction. Then tonic-clonic seizure, stiffness followed by violent contraction and relaxation. It is occur 1 to 2 minutes. Atonic seizure, in that case a person drop down. In myoclonic seizure occur a jerking movement of the body. Then abscess seizure is also called as a petit mal seizure. It occur brief loss of consciousness with minor muscle twitches and eye blinking. Second one is a focal seizure, is also known as a partial seizure. Then it classifies into simple partial seizure. Simple partial seizure does not involve the loss of a consciousness. The symptoms are the alteration of sense of taste, smell, sight, hearing or touch. Then dizziness, twitching of limbs. Then complex partial seizure, it involves the loss of a consciousness. Then it symptoms are a staring blankly and performing repetitive movement. Causes of epilepsy may be include brain condition including stroke or a tumor, then genetical problem, head trauma from the vehicle accident, drug abuse or a drug misuse, then infection diseases, lack of oxygen during a birth and brain damage that occur before a childbirth. Symptoms of epilepsy may be include temporary confusion, a staring spell, uncontrollable jerking movement of the arms and legs, loss of a consciousness, physical symptoms like fear and anxiety. Epilepsy can be diagnosed by blood test, MEG, that is a magnetoencephalogram, imaging test, EEG, that is electroencephalogram, then neurological exam, physical exam, and ECG. Next one is an anti-epileptic drug. Anti-epileptic drug are a medication used to treat epilepsy. Other name for anti-epilepsy is anticonvulsant. Classification of anti-epileptic drug. Now these are the following classes of anti-epileptic drug. First one is a barbiturate, example phenobarbital. Second one is a hydantoin, example phenytoin. Third one is a immunostilbene, example carbamazepine. Fourth one is a succinimide, example ethosuccinimide. Fifth one is a aliphatic carboxylic, example valproic acid. Sixth one is a benzodiazepine, example diazepam. Seventh one is a phenyltriazine, example lamotrigine. Eighth one is a deoxybarbiturate, example primidone. Ninth one is a cyclic GABA analogous, example gabapentin. 10th one is a newer drug, that is example vigaben and tigaben. First class is a barbiturate, drug including that is phenobarbital. Now this is a chemical structure of phenobarbital. IUPAC name is a 5-ethyl 5-phenyl 1,3-diazinine 2,4,6 trione. Molecular formula of phenobarbital is a C12H12N2O3. Molecular weight of phenobarbital is a 232.235 gram per mole. SAR of phenobarbital. Phenyl substituent at C5 position shows the optimal activity. N2 and N3 substituent result in increase in antiepileptic activity. 5,5-dibenzyl barbituric acid causes a convulsion. Phenobarbital bind to GABA receptor chloride channel complex. Then it increases the duration of chloride channel kept open. Then it increases GABA mediated chloride conductance. It leads to membrane hyperpolarization and shows the depression of CNS activity. Result of all this above shows the anti-epileptic activity. Phenobarbital is used in treating tonic-clonic seizure. It also used as a sedative and hypnotics. The adverse effect is a depression, anxiety, and poor memory. Depression is caused because excessive secretion of GABA receptor, that is an inhibitory neurotransmitter. Then side effect is a sleepiness and fatigue. Fatigue is nothing but thakwa. Then dose is a usual dose is half mg per kg. Dosage form is a tablet. Then brand name is a Gardiner. Now next class is a hydantoin. The drug included in that is a phenytoin. Now this is a chemical structure of phenytoin. IUPAC name is a 5,5-diphenyl imidazolidine 2,3-dione. Molecular formula is C15H12N2O2. Molecular SAR of phenytoin. Phenytoin and other aromatic substituent is essential for anti-epileptic activity. Substitution with alkyl group at position 5th shows the sedative properties of the drug. Phenytoin delay the recovery of sodium channel from inactivation. It also blocks the sodium channel in activated state. It also blocks the high frequency of a firing. Result in stabilize the neuronal membrane that occur the inhibit generation of action potential and inhibit spread of a seizure. Result of all this above shows the anti-epileptic activity. Phenytoin is used in tonic-clonic seizure. Side effect is a dizziness, drowsiness, and blur vision. Adverse effect is a hirsutism and hydantoin syndrome. Dose is a 10 to 15 mg per kg. Then dosage form is a tablet. Brand name is a Dilantin. Next class is a benzodiazepine. Drug included in that is a diazepam. Now this is a chemical structure of diazepam. IUPAC name is a 7-chloro-1-methyl 5-phenyl 3H14 benzodiazepine 2-one. Molecular formula is C16H13Cl N2O. Then molecular weight is a 284.74 gram per. B ring in diazepam is essential for activity. Carbonyl group at position 2 is essential for anti-epileptic activity. Double bond between position 4 and 5 is essential for optimum activity. Shifting double bond to position 3 and 4 decreases anti-epileptic activity. Phenyl group at position 5 increases anti-epileptic activity. Diazepam bind to specific site on GABA receptor. Then it increases the frequency of opening of chloride channel. Then it increases GABA mediated chloride conductance. It leads to membrane hyperpolarization. Then it shows the depression of CNS activity. Result of all this above shows the anti-epileptic activity. Diazepam are used as a sedative and hypnotics. It is also has an anticonvulsant muscle relaxant property. Side effect is a drowsiness and muscle weakness. Adverse effect is a sedation, depression, fatigue. Fatigue is a nothing but a thakwa. Dose is a 5 to 10 mg. Then diazepam is take orally, intramuscularly, intravenously, and rectally. Brand name is a Valium. Next one is a aliphatic carboxylic. Drug is a valproic acid. This is a structure of a valproic acid. IUPAC name is a 2-propyl pentanoic acid. Molecular formula is C8H16O2. Molecular weight is 144.21 gram per mole. SAR of valproic acid. The anticonvulsant activity increases with the increasing chain length. The introduction of double bond result in decrease the activity. Valproic acid is a drug which show multiple mechanisms. First one is it block the sodium channel which inhibit generation of action potential. Second one is it increase GABA concentration which reduces excessive firing of neurons. Third one is a inhibition of calcium channel function, which reduces glutamatergic transmission. The result of all this shows the anti-epileptic activity. Valproic acid is used in all generalized seizure. Then side effect of valproic acid is a nausea and vomiting. Then adverse effect is a weight gain, hair loss and liver toxicity. Dose of valproic acid is 100 and 200 mg tablet. Dosage form is a syrup or tablet. Then brand name is a Disantil or Elim. These are the links that have used as a source of information in this video. I would like to thank Dr. Shivajirao S. Zondhळे as a president of our college, Honorable Geeta Zondhळे as a secretary of our college, and Dr. Nitin Mohire as a principal of our college for encouraging us to create such informative videos. For such informative videos, like, share and subscribe to our YouTube channel. Thank